Hello, and welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Happy International Nurses Week and Day. So now, nurses play an indispensable role in healthcare, often serving as the front line of patient care and acting as a bridge between patients, doctors, and other healthcare professionals. Today's discussion will focus on the pivotal role of nurses in shaping the future of healthcare and the broader economic impact of their work. We'll also look at how investing in nurses can lead to significant benefits for healthcare systems, patient outcomes, and society at large. To hold this beautiful discussion, we have Nancy Onyinyechi Ndumel, registered general nurse in Nigeria, who's now a United Kingdom registered nurse. She joins us virtually from the UK. Good morning. You're welcome to the studio today.
Thank you. Thank you very much.
Thank you for joining us on Healthy Living, even though it's virtual, but we still believe you're here with us regardless.
Yes.
All right, so let's talk about some of the critical roles that nurses play. First of all, happy International Nurses Day to you.
Thank you. Thank you.
At least so we don't forget to wish you that, first of all. So let's look at some of the importance of having nurses in our lives and some of the roles that you play. So what are the core responsibilities of a nurse and how do they influence patient care?
Okay. Well, I'll say the responsibilities of a nurse are so many and it cannot be overemphasized. First of all, one of the core responsibility of a nurse, I'll say, is health education. Yeah. When it comes to health education, the nurse plays a very pivotal role in health educating people around them, not
Mm-hmm.
necessarily being their patients. You
Sure.
can see yeah, for example, now you meet someone maybe on the road, on the street, you have a friend who is a nurse. At that point, that you to that nurse, you might not be the patient, you might not be in the hospital, you get what I mean. But at some point in time, you may need, medical advice or advice regarding some an advice regarding health issues. And when you sit back like, who will I even call? You can't start going to the hospital, you can't start, I have this nurse friend and all, and
True.
just call them and before you know it, they say what they usually say is if a nurse is always claiming to have a busy lifestyle, busy life schedule, just tell them, nurse, please, there's something wrong with me, my health. And you see immediately they will respond. This is somebody that maybe from time to time you'll be like, hey, how are you? They won't respond. But once you
Of
just tell them,
course.
hey, I'm having some headache, I don't know what's wrong with me. You see, within minutes they respond. So
True.
health education, yeah, they play a vital role in health education. Nurses are the one that stays in the hospital, in the clinic, wherever they serve. They are the one that know the patients for who they are. They're the one that spend every time with the patients. So most times in the hospital, you notice patients when you ask them who's the doctor, it's like, I don't know, it's one black doctor. Maybe they've only seen the doctor twice throughout their hospital stay or once throughout their hospital stay. But the nurses stay with these
All the
patients.
time.
They know who they are, they know their preferences, they give this holistic care. So when health educating their patients, they kind of give this health education, you know, they give them opinions, tell them things to better their life. And also, when giving them this advice, giving them this opinion, they also tend to make it suitable in such a way that it fits their lifestyle. For example, you're a patient, maybe you're smoking, you're trying to quit smoking.
Mm-hmm.
Obviously, you don't smoke like that. So, and you're the kind of social butterfly, and I come to you and I'm like, nurse, I'm finding a way to quit smoking and all. Probably you're not, financially buoyant to, quit smoking. I understand this is how you are. So I'll give you options that fit your, social status. Maybe I can tell you, depending on your social status, some can afford, nicotine patch or
Mm-hmm.
electronic cigar, while some, you just have to tell them, okay, if you smoke 3 sticks a day, you can streamline it to 2 sticks a day. You can streamline it to 1 stick a day. Something like that. Or maybe you are obese and you're finding it difficult to lose weight. For a rich person, you can tell them you go to the market, you buy this, you buy that. For someone who is not financially buoyant, you tell them things according to their social status and how they can afford it. So we
True.
help educate people, yeah, and we also serve as advocates. There are
Hmm.
so many times in the hospital or in clinical settings, in healthcare settings, maybe after patients, doctor has done their clocking, done their test and all, they've provided diagnosis for a patient, and maybe um, the way to manage these patients might be through a surgery or their drug management. These patients have choices. They might not be able to, say that, oh, I'm scared of surgery. I have trauma
Hmm.
from maybe a loved one died out of surgery. They can't do it. They might not really be able to voice it out. But
Voice
you
it
being
out
the
to the
nurse,
doctor.
yeah, you being the nurse, you can, how do you feel about the surgery? Do you think it's something you can handle? You know, even if the doctors give them option, make them have informed decisions. Sometimes you notice that some patients are not really confident around doctors because the doctors are faces they don't see often, but nurses are the faces they see, often. They see them in the morning, they see them in the night, and there's some nurses that they see patients all through their stay, like till they are being discharged, while some, bless them, some nurses see them to peaceful death.
Hmm.
Well, some nurses see them at the beginning of life. So you see how it is. So we serve as advocates for when we feel that this is not right. My patient is not like this. My patient don't think this is right. My patient cannot afford this because of this. Um, my patient cannot take this drug because she's allergic to this. My patient, not just in front of the doctors, also like in front of other healthcare professionals. Because one thing about the healthcare setting is that we all work as one. The
Hmm.
multidisciplinary team, we work with the doctors, we work with the pharmacists, we work with the lab sciences, we work with social workers, we even work with, religious bodies because we provide holistic care,
True.
spiritual needs, emotional needs, physical needs. So we do this. And also, when you come down to the economic aspect, I'll say nurse is also helping cost savings because in saving costs, sorry, in like in hospital management, we have a long way because most times when hospitals do, maybe financial audits
Mm-hmm.
and they review things, the best way to know if some materials, like how materials are being utilized in the hospital, it still boils down back to the nurse. It's the nurses that know how many cannulas have been used so far. It's the
True.
nurses that know how many packs of cotton wools have been used so far. It's the nurses that know how many packs of syringes have been used so far. And it's still the nurses that will give their feedback on how, okay, so patient don't really need this one, don't really need this. I feel the hospital should cut down on cost of this, the hospital should cut down on cost of this. So yes, we have like our roles cannot be emphasized. If I should start listing
I
our roles,
honestly,
might
I
it might
honestly
take
can
a long,
imagine. That's
yeah.
a whole lot.
So
That's a whole lot you've
yeah,
actually opened us up to in the couple of minutes. But then, because of what you said, also
yeah,
likening it to the fact that nurses are bridges to every other aspect of the medical line when it comes to patients.
yeah.
Now, how do nurses impact, the quality of the healthcare services and patient satisfaction?
Okay. Um, how nurses impact the quality of this
Okay, apologies
healthcare
before you
service.
answer that question. I wanted
Mm,
your hand sometimes is blocking your face, and I
okay.
wanted you to sit back while you talk so that by the time we're done with this recording, you'll not be asking yourself, why is my video like this?
Okay.
So that it would, even if you're talking, your hand does not block. So I'll ask the question
Look,
again. Yes. Should I go?
Yeah.
Okay. All right, you've shared quite a lot with us in just a couple of minutes, and it's really, really interesting to learn that nurses play this so much role when it comes to our healthcare. Now, how do nurses now impact the quality of healthcare services and patient satisfaction?
Okay. First and foremost, because nurses are like the one, well, I say the one professional in that team that literally interacts with every other professional. You might see the lab scientist might not interact with a social worker. The
Hmm.
lab scientist might not interact with the pharmacist, but the nurses interact with everybody. So they kind of bridge the gap in communication between healthcare professionals, and they tend to enable this continuity of care.
Hmm.
I don't know if you understand. Like maybe this patient has come, okay, via the emergency routes in the hospital, and they were told to carry some tests and all. After carrying the test, okay, now the test report has been sent to the lab scientist. When the test result comes, it doesn't come back to the doctor. It passes through the nurse, and the nurse, escalates to the doctor. When the doctor sees it, he recommends medications. This medication does not go straight to the pharmacy still. It still passes through the nurse, and when the pharmacy receives it, it does not still go straight to the patient, well, except maybe it's an outdoor patient. But even if it's an outdoor patient, the nurse still it still goes to the nurse, and the nurse still has to do some health education and all. So improving this care when this all these informations, like it all comes down to the nurse. When the nurses, help educate the patients on, okay, or give them feedback on so far how their care have been and all, they kind of reassure them, and it kind of boosts these patients' confidence. And
Hmm.
sometimes you tend to see that some patients, maybe previously, when their family member have been telling them, you need to do this so that you won't end up like this, they don't really take it serious. They don't really, no, no, no. But when a nurse tells them, and with that compassion and care,
Sure.
that soft voice, in a non-judgmental way, because we are trained to be non-judgmental, irrespective of your tribe, your status, your age, they tend to, we create a safe space for them. So they tend to be more compliance, you know, reducing the risk of them relapsing or going back or falling back. And sometimes this health education we give, and we tend to see that it makes them confident, it makes them happy, it makes them feel involved, it makes them, I don't know how to put it, but they feel more involved in their care. They feel it gives them this autonomy in their care. And when patients feel like this, when people feel happy that they are able to make the right decisions regarding their care, it reduces hospital admissions, it
True.
reduces the development, or let's say the spread of some certain diseases.
Mm-hmm.
It reduces the risk of them acquiring certain diseases. Sometimes from time to time we perform audits in the hospital, and you see that sometimes it's not actually the drugs, or it's not actually the drugs that makes difference. It's the communication. How effective were we in, how good were we in communicating with this patient? Because communication goes a long way, not just verbal communication. Sometimes body languages and the rest of it. And we, the nurses, are the ones who are one-to-one with these patients. So our body languages really matter when attending to these patients. Our voice, our tone really matter when talking to these patients. And if we are very receptive, we communicate with them nicely, we do all these things with them nicely, we see that on their own, they feel good about themselves, and they feel involved, and they want to do more to better themselves. They feel more happy about themselves, and you can see there's a like improvement in their health status and the rest of it. And also, um to the maybe to the agency or the organization at large, you can see maybe they can give an audit. Okay, we noticed that from so months to so months, we had this percentage, but after this, it reduced. Maybe the risk have reduced. The the risk of let's say the rate of patients with
Mm-hmm.
seasonal disease has reduced and all that. So in general, nurses really help in improving like
Honestly,
we are where every healthcare professional is I would say is dependent on
dependent.
us.
I wanted you
Yes,
to say that.
they are very much dependent on us because without us they will be very confused. You know,
I
some doctors
agree.
will come, no, sorry, this
100%.
patient.
You make
No,
your
sorry,
job
this patient.
you make your job
This
so
patient.
enviable.
No,
I wish
it's
I were a
nice.
nurse right now, but I think I'm happy talking rather than having to treat people. Thank you very much. So this year's theme
Yeah.
states that nurses are future and the economic power of care. Now, how do nurses actually contribute to cost saving in healthcare? I know you were trying to say that earlier, but I want you to open
Yeah.
us up more to how you contribute to cost saving in healthcare, especially through preventive care, patient education, and chronic disease management.
Um, okay. Um, well, patients like in aspect of preventive care, preventive care really helps in reducing costs. So that's where the health education comes in. When there's early, when patients come in, they feel somehow they are given health education on the risk attached to certain illnesses, what they should do in later times. Okay, let's look at antenatal. When a woman is pregnant, she's always advised to go for antenatal care. And we've noticed that most women that attend antenatal, they have low risk of developing, there's low risk of um, um, death during childbirth or death during pregnancy or loss of child and loss of stillbirth or loss of pregnancy. So we see that this preventive care helps in saving costs for these patients and also for the organization and for the economy at large because every year a certain budget is being not just in Nigeria, worldwide, every country has a certain budget that is allocated to them for healthcare. So it's left for the Ministry of Health, Organization of Health, know how to portion all this, you know, to budget all these finances to the various aspects
Yes.
of health. So when there's health education, there's um early detection of
Any
things
underlying
that could really
disease.
cause harm. Yeah. So when this happens, you see that there's reduced cost, maybe something that would have cost them a million, thousands, billions, just to do surgery and all. The simple word of advice, simple, don't do this, don't do that, will save them a lot.
Sure.
Yeah. And also um like workflow, that communication flow. With nurses bridging the gap in communications, errors are being you know
Avoided.
there tends to be little errors. There errors are being avoided because sometimes maybe if nurses are not there, maybe the doctor recommended the test. This patient has done this test before. They've seen the result. Maybe because there's no proper communication, it has not been related to the doctor, or it has not related to the lab sciences, or it has not related to whichever healthcare professional is supposed to get that information. You see, they tend to repeat tests, unnecessary tests that is not even needed. dictate requests for things that are not needed. But with nurses in place as advocates and we knowing this patient, we can come in place and say, this patient does not need this with evidence, with facts. Because one thing in nursing is that's what differentiates us with auxiliary, all this group that few people are employing now. You ask people, why are you doing this? Now so did they do am, now so they do am. But what makes us exactly, it's not, we don't, now so they do am. Why are you doing this? We have evidence-based practice. We have facts to back it up. Okay, I don't think my patient needs this. Why? Because this patient is allergic to this. Doing this might cause greater harm. Doing this might cause greater
True.
harm. You have helped in reducing an error, and maybe probably that error to reverse it might cost a lot. I don't know if you get what I mean.
Of course.
So you've helped in avoiding that error, saving cost, and the rest of it. Also, proper utilization of hospital resources. Sometimes when doing some procedures, maybe because we are the ones that have cleaned this patient, we've vetted this patient. You see some people, maybe when not some people, some doctors, or maybe even our fellow colleagues that are not really, maybe they are new to the world, they want to carry out a procedure, and maybe they'll bring like maybe different sizes of cannula or different sizes of catheter. We that know, no, this patient is not this size, is this size. Instead of carrying multiple cannulas or carrying multiple catheters, we just say them just use size 6. That is the right size for this patient. Just use this. That is the right for this patient. Just use this. This is a very big patient. That instrument will not be suitable for her. That is because some they will do try and error, try and error, try and error. Doing this try and error, you tend to waste
To wear out
resources.
the patient out too.
Yes. So exactly. But when you know, no, this is not this, this is not, you're helping, saving time, saving energy, saving resources. So yeah.
It's
What else? There's so many. There's just so many all over my head right
I
now.
know,
I can't
right?
really think of more.
In fact, it sounds like I should never interrupt you. Let's just keep going. But then, as sweet and rosy as your profession can be, I know every profession has its
Yeah.
own challenges and opportunity. So let's
Oh,
quickly run
mm.
through yours. What are the current challenges facing the nursing profession, especially when it comes to maybe workforce shortage? You may want to tell us why
Well,
you have chosen to run away from your birth country.
okay. Um, for there's little or no um appreciation or support from organizations. You know, we all know this pandemic of Japan of nurses that is happening now.
Of
When
course.
you ask somebody, yes, even if, why are you a nurse? I love my profession. I love what I do. Yes, you know you love what you do, but sometimes in loving what you do, you also have to make the things sweet so that me self I'll be encouraged, add small something. Yes, I know
After
I
all,
love
something
to be
feels
a nurse. I
passion.
want to be I want exactly something for us passion. So there's really poor support, poor appreciation. You see, I sometimes when I was really new in this profession, I'll see like my fellow colleagues who are family people, mothers, and me. I'm just in the profession. I'm a single lady, and I'm like earning this amount. And you see me middle of month, I'm already crying. Oh, my salary are finished. And you see some people they have 4 children, 5 children. You pay school fees,
You pay
you
house rent.
transport yourself, you pay house rent. How na they do this thing? I don't get. Me, I'm not doing anything. No. Even the house I'm living, I'm not paying house rent. My own don't finish. I'm crying. How are you people doing this thing? And despite not, poor salary rates, you are not like doing things to support them. You see a nurse, um, one thing about nurses when we tell people, sorry, I was on duty, they'll give you'll be on duty 5 days a week, 2 days off, 6 nights, one day off. Like it's not flexible. You don't have time for yourself. And one thing about nursing is that nursing is, aside being physically demanding, it is mentally demanding, because human beings, human beings, we are all different. Our behaviors are individualistic to us, unique. So the way I handle Mr. A is different from the way I handle Mr. B. You have to be emotionally intelligent to understand the emotions of people around you, so you know how to act, and you know what's okay. If this man is an aggressive man, I know how to handle this one. This one is a soft man. So this is really something that is emotionally demanding, mentally demanding. And when already you're already, aside work life, you're already not having a balanced life at home, you don't have time for yourself, and all you come to work, you face the same, it just wears you down. So
True.
that's one thing, is draining physically and mentally. Another thing is that nursing is stereotyped. Stereotyped to be a feminine role,
I thought so
but
too.
no,
I was even
it's
going to raise
not.
that.
It's not. I went to a military nursing school in Lagos.
Okay.
So originally, my set is the first set of civilians. Originally, they train personnel, and that is military and paramilitary. It's their own, like, yeah, soldiers, navy, and you see lots of male nurses there. And I can tell you that, in as much as female nurses are good, sometimes I'm like, I may be biased because I'm female, but male nurses are good. Like, they know what they do. They know what they do. Like, they are very, very good, very, very smart. So sometimes when you see young children, what do you want to be? You hardly see males saying, I want to be a nurse, I want to be a nurse. Like, it's not exactly. So it's, and one now with things, you see, there are some roles in nursing. When you're even applying for a job, they'll tell you males only, males only, males only. And you
Wow.
come and be wondering, why is it males only? Because sometimes they kind of, maybe they deal with mostly obese patients, or maybe they deal with, trauma patients, which usually deal with lots of, machines and equipment that they don't think females can really
Can
handle. And
handle.
that's one thing. Yeah, exactly. So this lack, like, taking making nursing be like is for women. No, 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 no. It's another challenge we face. Another challenge we face is that some people say nursing is for, will I say, people with low intellect. In Nigeria, for example, let me use Nigeria as a very perfect example. When JAM fail you,
You go to
you
school
do
of nursing.
JAM admission. Exactly. Mama Cynthia, just send that to School of Nursing now. Just send that to School of Nursing now. It's it's really depressing, because people think, is although there is, no, 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 no. I went to a School of Nursing. Yes, I won't lie, my story was something like that, because I never wanted to do something. In fact, mine was even bad. It's not even health. I didn't even want to venture into health. Doctor, is it pharmacy? I did not want. No. What I wanted was engineer, pilot. I wanted to be dealing with screw open, not all those things. I didn't want I didn't want anything to do with nursing. So it was like, it was also like a last resort for me. And I was like, why nursing? Everybody, when my mates are graduating, with high class, me, I come and be finishing with nursing and all. But when I went to nursing school, no, it's not like that too. It is hard. Yeah, it's, you have to also be, academically sound. So it's not for people that are not intellectual.
Let me use the local
No.
palace language. Nothing no be beans.
Exactly, not to know big beans. So it's and now with good changes, thanks to, like, at least NMC, and they are making changes. They are kind of making nursing now not a, they are clearing out, I think, School of Nursing. They are now making nursing, you must have, when you
Attractive.
finish from the nursing school now, HND or BNSC, whichever one, which is good.
Of
At
course.
least with HND, you have your two qualifications, general nurse and public health nurse, or general nursing and midwifery, which is just like the university too. So
Aye.
it's good. At least people know that, yeah, this is a profession. Though they
True.
call it a vocation, but it's a profession, because you are
True.
trained. You are trained. It's not you don't go to one hospital and now what you go and snap with injection or stethoscope.
All right. Thank you very much. But
Auxiliary.
let's quickly go on this break. When we return, we'll be talking about how you manage stress and prevent burnout in your work life as a
Yeah.
nurse. Let's quickly
Okay.
go on a break very shortly.
Okay. Okay.
All right, viewers, I hope you're enjoying the conversation with Nurse Nancy. Let's go on a quick break. When we return, the conversation continues. Stay with us. Because we're still discussing with Nurse Nancy on this day in celebration of International Nurses Week and Day. So, Nurse Nancy, before we went on that break, you were telling us of some of the challenges that you go through, that nurses go through
Yeah.
in the profession.
Yeah.
So let's look at how you get to manage stress and prevent burnout and maintain a good work-life balance.
Yeah. Okay. Um. Yeah. How because like I've earlier said, this cannot really be overemphasized. Nursing is a very demanding job, physically, emotionally, mentally is draining and is very demanding. So how most times you need to know how to manage stress in order for you to cope. If not, if you are unable to manage stress, you tend to um your workplace tend to become very toxic for you, and with time you burn yourself out, you form poor relationships, and when this happens it really affects the kind of care you render and you give to your patients. So what one should do, like as a nurse, what you should actually do is you kind of prioritize your tasks. That's why they always advise when you're a nurse, it's always advisable, like learn to show up to work early. It's not like
Okay.
other job that's when you go five, somebody like me, I tend to like sometimes I come like 20 minutes early to work because I know the kind of people I'm dealing with, the environment I'm dealing with. I'm working in elderly medicine, and you know how it is to deal. When I mean elderly, I don't mean 50s or 60s. I mean 80s,
Wow.
70s, and these people, most of them suffer from memory loss, immobility, and all. So I know the kind of patients I deal with. So you come early to work, and you prioritize your task, starting from the most urgent one, heavy ones, then you streamline it down to the less important. Some the ones that even under pressure within 5 minutes you can do it. You prioritize you prioritize your task. Then this prioritizing your tasks helps you, to know if there are extra things you are leaving behind. Okay, after I've done this, do I still need to do that?
Okay.
After I've done this, do I still need to do that? Do I still need to do that? It makes the workflow easier for you, and it makes you more focused and concentrated. Because even if you have tasks at the beginning of, trust me, even if you have tasks like when you come, there are already tasks waiting for you. On the shift, more tasks will come, even worse than the one you're expected to do. So you have to create time. Okay, if I finish this big task, I finish this small task. Obviously, there will be other tasks. Okay, hopefully I'll use so time. And another thing is learn to hydrate well, because not having enough water, people test. Sometimes when you don't drink water, I don't know, subconsciously your body becomes your mood, you wouldn't know that maybe it's because you are dehydrated. Dehydration causes this kind of tiredness, but you won't know.
True.
So it's best to always, stay hydrated. Like what I do, what people do now, they buy this raining bottle that is tagged,
Yes,
okay,
with
it's timing me. Yeah,
yes.
help yourself. If you can't remember, at least that will help you. Okay, it's 2 o'clock. I've not even drunk up to 2 o'clock. It's 5 o'clock. Help yourself and eat well. Eat well. Some nurses, you see, they'll come to, why have you not eaten? Work. If you die, Nobody take care of that patient. You want to kill yourself.
True.
If you die, you are no better. You are worse than your patient. And a sick man cannot take care of sick man.
I agree.
Yeah. And also, open up. Don't I always, because when you don't ask for help, you you tend to try to do things on your own, and you make mistakes. When you make mistakes, you have to go back, start from beginning. That back and forth, back and forth, back and forth. You are wearing yourself out, you are burning yourself out. All this could have been avoided if you could just say, please, not this. How do I do this? How do I do? There's no harm in asking for help, even from the lowest staff, even from cleaner. There's no harm. You need to move a patient. Ask, please, can you join me? Let's do this. You need to get something. Please, can you help me do this? You need to do, please, can you help me? It will save your time, it will save your energy, and to avoid unnecessary mistakes. Um, Another thing also is, seek, aside asking questions, seek support. If you
True.
feel there's something bothering you, you are not comfortable around maybe a staff that you work with, you feel intimidated, you feel bullied, speak out, talk, so that no one day will come to work, will see later. If I had known she was like this, you know what
Suicide.
people do, all those things, yeah, exactly, suicide. I'm
Do
telling you, like,
nurses really get
this nursing work,
suicidal?
yes,
Wow.
some family relatives can make you run mad. Some family relatives can haunt you even outside your workspace. Is that bad? That's why here, one thing about nursing is, that's why I say we work based on evidence. You document, you seek support. If you decide to just, I'm not going to care for this patient because this is this, who did you tell? Who did you escalate to? Who did you report to? At every point in time, escalate, seek support. When you've done all these things, you know, and maybe there's an error, there's a mistake, you've been justified, you
True.
did this, you tried reaching out, you sought for help and the rest of it. So when you need support, because sometimes some people battle, this is not just like, generally some people battle with confidence, like they don't know how to disclose information, especially when dealing with some kind of families. You don't know how to disclose some information. Maybe in your care a patient fell down, in your care a patient developed a pressure sore, a pressure ulcer or something. You don't know how to tell the family, I'm sorry, while in the hospital, or maybe the patient transmitted nosocomial infection, hospital-acquired infection. You don't know how to disclose it to the family. Then maybe when you do it, the family becomes so abusive, maybe verbally. Sometimes it takes a mental toll. When
Hmm.
the next time you are trying to render, service, you are not so confident again about rendering service, and it kind of, it just really makes you not balanced, not focused. So in cases like that, you always seek support. You can't face this family. Look for a colleague that can do that. You are not competent enough. Look for a colleague that can do that. Always, always. My logo, even as I'm here, I'm still new. I might have experience from Nigeria, but here is a different system. It's a whole new race. It's a whole new, different policy. So always tend to seek support. So managing stress, there are so many ways. The main thing about managing stress is know what works for you. If you are following North because North does it like this, you are hearing just North, how do you do it? North tells you how to do it. It's now the way North does her own. You must do your own like the way North. You might
You're missing it.
burn yourself out. Yeah.
True.
So just know what works for you, understand yourself. Okay, am I more active like this? And some nurses, they know themselves. They don't like day shifts. Some like night shifts. So they form good relationship with their nurse in charge or their ward manager, who always like tend to put them on night shifts. You are more good at nights. You are more good at day. You are not good in this department. Opt for a transfer. You don't know how to work with you are better in accident and emergency, the one that you don't need to ask patient, man, please, opt for a transfer. You don't know like, know what works for you, and it will go a long way. And when you are out of work, don't kill yourself. I know they say we should be caring and compassionate, but life does not revolve around your patients. Help yourself, relax, go out. One thing with nurses that is in Nigeria, you see some nurses, you see them in work, they look so, but when you see them outside, this, but at work, that is at work, my dear. Work is different from home. Home, I'm home. Like, so you understand? Yeah, that's
Absolutely.
just know what works for you.
Honestly, while you were talking about all of these things, I was surprised because
Mm-hmm.
nobody would ever think that nurses go through some of these things that you just opened us up to. Because the experience we have with nurses here, well, some nurses, in fact, let me share my personal experience. So while I was undergoing antenatal, I remember some nurses would just treat us like piece of trash. Some of them would just attend to us and
Oh,
say, hey, do this, do that, or move here, move there. They're just let me use the word rude. They're
rude,
just rude
yes.
to us. They act the opposite of care to
Of
us.
what?
Exactly. So you hearing this, in fact, when I was in labor, one of them literally sent me back home, regardless of the contraction or how
Yeah,
quickly I was contracting. She sent me back home. And that made me give birth on my way back to the hospital. And then the doctor in charge was so mad and he was asking what if this had become a case of the other way around.
medication.
Like I had to give birth on my way. Did you notice the contraction? Why did you send her back home? And it became like, I didn't ask her to go home, I asked her to hang around. But you literally asked me to go home.
So
There's
he
no yet
said,
time.
go
She said,
back
you're a
home.
first time mom, it takes a while, go home. Like she didn't even check. She just chased me back. She didn't even look at the timing for the contraction. We were taught that, okay, contraction at a particular space of time, duration of time shows that you're getting really close. But she didn't care about all of that. She literally
She
just
didn't
sent me
check.
back home. And I now gave birth on the way. The doctor in charge was so angry. So the experience we
Yeah.
have of nurses is as though they can sometimes be bullies, and you never ever look at it like they can be bullied. So you opening us up to some of these things is really amazing on a day like this. But what can we do to support nurses and ensure a sustainable workforce and have them give us the care that they have beneath them? And it's not like they are being burned out with other activities and they're transferring some sort of aggression on their patients.
First off, one way you can, is when you see a nurse squeeze something in her hand. I'm only joking. The thing is how you can actually help nurses because some of those things, from what this story you tell me, I would say it will be frustration because one thing about nurses in labor ward or gynae is that the truth is patients can be very stubborn. Ah, mm, patients. Sometimes you see some patient attitude. You're like, is this one a child? Like you literally so that's frustration and all. I know it's not good. It's not does not really justify this attitude because we're expected to be compassionate and caring irrespective, but we are humans too. So one way is you can be supportive is first and foremost you should try and be compliant. Some people are very, very stubborn. You have an appointment by so time. Come. You're supposed to take this job by so time. Do it. Because sometimes this, you know, going over, repeating, I mean, you're not the only person these nurses are literally caring for. There are people, everyone is important, but there are cases that are more serious and deadly than yours. And you like helping them doing all the you see some nurses they are so nice some patients they'll be like I miss that patient. Why do you miss him? It's not that the patient does them anything or did anything. The patient is just easy going smooth. You make work easy for me. You make it less stressful for me. So patient compliance we should like patience because me sef, even as nurses we can be patient too and trust me we can even be the worst patients at times. So compliance it helps. And also um I noticed that most organizations especially in Nigeria don't have like a support I earlier mentioned in managing stress, you seek support. Unlike here they have so many bodies within, now not independent bodies within the hospital organization that provide really good support. I mean, when I mean really good, like really good, they check up on you, how are you coping, how are you faring, anything at all, you need anything, don't. And when you actually tell them your complaint, they look forward to meeting those needs of yours. But back home, you hardly see. They don't have time for you. You're just a main staff. So your own is work for them. They'll pay you. They are not looking at your well-being, your development. Here, the way the scope they use in trapping us is, you are working for me. I'll pay you. In the same time, I'll develop you. You know, I will career wise, I will develop you. Skill wise, I'll develop you. Theory wise, I'll develop you. And this encourages you, like, even if you have but these people are actually trying for me, and I really need to develop my skills. So that motivation is there. Even if you want to give up, remember that there's support, there's career development, there's skill development. This will actually help me boost my practice. So there's this motivation, and they give incentives like, here, when you work bank holidays or you work on social hours, maybe you work Saturday night, entering Sunday nights, there's something for you, like there's added something. These kind of things encourage, these incentives, recognizing, or maybe when a family member, because here, when a family member actually like tells your ward manager that nurse is good, they give you appraisals, frequent appraisals, all these things subconsciously to your mind. It helps you, keeps you motivated, even if you are, stressed out sometimes. That motivation kills out the stress. But I'm not saying you should go and do past yourself, but at least that joy, yes, that joy is, at least I know that I'm not working my ass out without going unnoticed. Like, people really value me. You feel valued, you feel recognized, and it pushes you, it drives you, to do more.
Absolutely. But what is a common misconception about nursing you'd like to clear up? I confess, in fact, I must confess that I'm
Great.
one of those people while I was younger that believed that a nurse has to be a female. It was unusual to find a man in that field. But what's the
Yeah.
common misconception about the nursing profession that you'd like to clear up today?
Nurses are doctors' assistants. No, we are not. We are independent. Most people feel that nurses are doctor subordinates. No, we are not doctor subordinates. In as much as doctors cannot carry out some roles on their own without us, that's the same way we can't carry out some roles without them. We are team members. A nurse has the right to query a doctor's, action, has the right to stop a doctor's action. We are not subordinates, we are team members. Also, all nurses are rude. All nurses must, have this kind of look. As a nurse, you must not take care of yourself. If you want to make hair, you make one particular style of hair. You don't do good. You don't do makeup. No, 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 no,
We
no.
thought
Please
that's what it
look
is.
good. No, please look good. Look good. It even makes your patient even feel more happy, safe, more
Yeah.
receptive.
Aisha will
Eh,
not distress
yes,
your
look
patient.
good. Look good, though. Look good.
Don't mind me.
Look good, please. And all, like, nurses are rude. Like, some patients, well, I'll say it's those days, even in nursing school, I won't lie, the kind of clinical educators we had, yes, some of them are so I won't blame some patients for saying, that matron, she's very rude, because, yeah, but now it's not, we shouldn't, like, you are a patient, you have rights, so you shouldn't feel intimidated when if a nurse open eye for you, sorry, but you also have the right to open eye back for the nurse because it's your patient. You have your patient's right. So, and also not all nurses. We should not. Maybe this is my position. You know, sometimes when you are frustrated, you're at work, you have been at work for your face is just strong. So your face is just strong. So this nurse na no go area. Meanwhile,
As
clinically, that
a
person is one of the sweetest nurse you can find in that department because of work frustration. Yeah, that kind of so is a normal misconception. And just like you said, we've been stereotyped to be a feminine profession. No, we need men in this profession. Men, you are the the men that I work with they are they sabi work. If I cannot do something, Stu, can you help me? They'll help. No, we need men in this profession. Please, you are very much appreciated. We like men are needed. It's just because of some procedures, people don't really find it appropriate, as a man, but it's not a feminine. It's just that the nursing, the founders of nursing, the forefathers, I'll call it, or foremothers, they were mainly women, but men, it's not a gender based. Men
profession.
can equally do, yeah, men can equally do nursing.
I like
Yeah,
your
so.
I like your stance on that. But what would be your advice, in rounding up now, what would be your advice for an aspiring nurse out there? And what's that one thing, if you had the chance to tell the world about the nursing profession, that you would like to share?
Okay. My advice is okay. I forgot to mention this in a misconception, but it has to do with my advice.
Okay.
Nursing is beyond bedside. We should not um have this picture in our mind that nursing is all about chicken injection, bedside, packing sheet, packing away. No, 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 no. There are opportunities beyond the hospital setting in nursing. There's research in nursing, there's clinical education, there's nursing simulation, and all these are outside. Most of them, you don't even need to have contact with patients. So some people are scared, but I cannot deal with human beings. So I want you to know that nursing, there are so many opportunities, so many outside the bedside nursing. So if you want to be a nurse, explore check out different, aspect of nursing. It's not only bedside, there's so many aspects. Yeah. And
Your advice for an aspiring
nurses are
nurse?
really, yeah. My advice for an aspiring nurse is if you're an aspiring to be a nurse, you feel that yes, it's your calling. I want you to go ahead and be confident because what kills most people is lack of confidence because you deal with so many people, you deal with so many other professions. You see one thing with doctors is they always wear this confidence on them. You see small junior doctor talking to matron, like, but you see nurses were so timid, so shy. Even a small junior doctor will be talking to you now. Have that confidence. And please, I can never, like, this cannot be overemphasized. For your own safety, the safety of your fitness to practice, if you don't know how to do something, don't do it. Don't do it. Always seek support. Always ask for help. If you are not competent enough, don't do it. Nobody, when you go to the court of law, when something happens, the first question will be asked, are you competent enough? If you don't have fact, if you don't have base, everything will fall back on you and to question your fitness to practice. If you are not competent enough, if you don't feel confident enough, don't do it. Always seek help. And one thing that every nurse will tell you, always document. Patient refused drug, document. Doctor shouted at him, document. Pharmacist did not bring the drug, document. All this will back you up at the long run whenever the world goes against you.
Thank you so much for your time today, Nancy Onyinyechi Ndumel, Registered General Nurse in Nigeria and United Kingdom Registered Nurse. Thank you so much for your
Yeah.
time today.
Thank you.
It's really, really interesting having to,
Yeah.
get all of these insights from you today. Thank you. And we hope to call in on you again some other time soon.
No problem. Thank you.
All right, viewers, thank you so much for being a part of the show today. At least now you know all that nurses have to go through for you and I hope you get to appreciate a nurse today. Happy International Nurses Day. And that's a bye from me, Olamide Alhassan. Bye for now.